Excellent. Well, good morning, good afternoon, good evening, everyone. This is Jeff Klausner from UCLA. Welcome to our monthly Fogarty GloCal career development discussion. I'm very pleased today to be able to introduce Dr. Yang Li Min. And Dr. Yang is an associate professor at Hanoi Medical University. He's been working with University of California and UCLA for nearly 20 years on a lot of research related to HIV prevention, substance use. He's been the lead for a lot of different interventions on medical or opiate substitution therapy in Vietnam. Been a collaborator of mine now for about 4 or 5 years. He will be a GloCal Fogarty supervisor starting this summer, and he's also the PI for also almost 20 years of the NIH CREATA program, which he's going to talk to you more about. And he has a lot of experience working in international collaborations with junior investigators, and has been a very supportive and productive mentor. So without further ado, Dr. Yang.
Thank you. Can you hear me? Hello?
Yes, we can.
Yes, thank you. Thank you, Professor Klausner, for the kind introduction. And thank you, the GloCal program, for asking me to give a talk today. I'm very happy to participate in this program since I think 2016, and now to be here with you today for the with the fellows from for the program in 18 and 19. So can you hear me well?
Yes, Dr. Yang.
Okay, great. So I think that in the next 15-20 minutes, I would like to share with you my sort of career path in global health, and share with you some of the of my work, as well as the what I have been doing in the past 20 years to build a global health career. And this one is from a perspective of a researcher who are based in mostly in a lower middle income country. And although many of you, I think that I've seen quite a few fellows who are from such setting, but many of you would, although from the US, would have been working with people like me in, when you come to a foreign country, or already have worked with some people like me. So I hope that my talk will help you to think about your work now and also in the future. So please stop me if you don't hear me, or if you want to ask question. So this is my path to in global health and also to global health. I graduated from Hanoi Medical University as a general practitioner, but then I, after working a while in a community medicine, I became interested in medical anthropology, because the one of the area that I worked in early career of my medical training and also career was in the ethnic minority areas in Vietnam. So I went to Columbia University for my master training in medical anthropology, and then PhD training in socio-medical science, which also have a broader view, taking into account social and economic issues, determinants of health. While at Columbia, I was also working as a part-time at the National Development and Research Institute, a non-profit organization that were at that time was very well known for research on and education on HIV and drug and substance abuse. So that was my time in the US, and then I got a funding. My first US funding was with the, and I was very thankful for, was with the Social Science Research Council for my dissertation. And I completed a dissertation completely a anthropological study focusing on young men who migrated out from their home community to build a national highway, and looking at the masculinity, the construction of masculinity, while they were constructing the national highway. And I so that was my dissertation. But while I was working in Vietnam and on my dissertation, one of my professor at Columbia, he enticed me into getting involved in NIH application. And we were Professor Michael Klatz, and we were very lucky to got the first R1 from the first try. And there was a golden time for NIH funding in early 2000. So we got the first NIH funded grant to look at the transition from smoking to injection among heroin drug user in Vietnam. And from then on, I never looked back on the just working on anthropological study, but was trying to become a more multidisciplinary and trying to learn from other disciplinary in research. Then I came back in Vietnam in 2012. Actually, starting in 2008, back and forth between US and Vietnam, but permanently moved back to Hanoi in 2012. And then I became the Deputy Director of the Center for Training and Research on HIV/AIDS, and now renamed to Substance Abuse and HIV. And since 2015, I've been appointed as a chair of the newly established Department of Global Health at the School of Preventive Medicine and Public Health in our university. So that was my path to and in global health. And as you can see that I sort of zigzag between medical training, social science training, and back to biomedical research, and then also trying to working on multiple disciplines. Just a quick overview of the center that I am leading now. The center actually has three major components, like cores. The first one is CREATA, was the main core that was established in 2004, and it's provide the core support, research support, admin support for the whole center. But there are two very important areas that we developed in the later years. The first one is the sexual health promotion clinic, and this clinic is for MSM and transgender in Hanoi. As you can see in the photo here, this is the launching of the new space for the clinic, and also the PrEP service that was supported by CDC US and PEPFAR. And in the picture here, you could see the DCM, the Deputy Chief of Mission of the US Embassy, and some people from Ministry of Health who came to the opening of the new clinic space. Down here is my team at the center. The people who are in the blue T-shirt are the clinic staff. The other also important core of the center is the ATTC, which stand for Addiction Technology Transfer Center. And this center has been supported by SAMHSA and PEPFAR since 2011. And we focus a lot on building capacity for addiction workforce, and also working with the substance user, people with substance use disorders. And here in the picture of the center, you could see an American, he's Eric Artman. He's a third-year medical student from University of Miami who got a Fulbright scholarship last year, and he's now finishing his term with us, and he focus on his work focus on the understanding the attitudes and knowledge of medical students on LGBT health in Vietnam, and develop a modules for medical students at Hanoi Medical University. From our work, we welcome a lot of students from the US who got the GloCal NIH funding or Fulbright funding to come and work with us. So how we were able to build all these components, cores of the center? I think that in summary, it's through different funding scheme. So as I mentioned, that we started in 2008, the first NIH grant that focused on injection drug user. And since then, Professor Glatz and I and another colleague, Dr. Lloyd Goldsam, also at NDRI, we have got a few NIDA funding and also a Ford Foundation grant up until recently. And on the basis of the last grant that was an implementation science study on sexual health for young MSM, we developed the sexual health promotion clinic, which is now a very important component in our center. We also build the other capacity for the center as well. We had a 10 years now of funding from NICHD, which is an institute at NIH that focus on social science and research and training on HIV/AIDS. And this project, I've been collaborating with my advisor at Columbia, Professor Richard Parker, and my mentor also at Columbia. To develop the VHATTC, the Vietnam HIV Addiction Technology Transfer Center, we have been supported by PEPFAR and SAMHSA to collaborate with UCLA Integrated Substance Abuse Program, starting with Professor Rick Rosen and then now Dr. Sherry Larkins. That, as I mentioned, the work has been focusing on developing addiction workforce and working to develop new treatment in Vietnam. And from the work that we have been building with VHATTC, I first welcome Professor Todd Curtius from Oregon Health Science, and he was a Fulbright scholar during 2012-2013 at HMU, and I hosted him during that time. And then at that time, we developed an NIH grant application, and we got funded also for the first try. And now the project has been going on for 5 years. Another collaborator, also very close collaborator, is Professor Gavin Barth from University of Minnesota. He has been a technical advisor for our ATTC since 2010, and we also developed a NIH NIDA-funded study on the pharmacokinetics of methadone and ARV interaction. These are some of my own funding from NIH and other sources. I was a PI of a small study looking at the role of the family in supporting HIV-infected injection drug user. I was also a PI of a study supported by the government of France through the INRS, which is the agency by the French government to fund HIV and hepatitis research. And also, most recently, I was a PI of a study funded by PEPFAR and CDC to document the HIV incidence and behavioral change among MSM in Hanoi, based on the work that we did earlier among MSM. I also failed as well. Submitted since 2016 two NIH application. One was unscored and one was unfunded. So there was the application that I was the PI, contact PI, but also we had other unfunded application that I collaborated with other colleagues. So throughout the years, I've been very fortunate, and I have to say that really in global health, partnerships are the key. If you look at the row, the first row pictures here, you see the in the middle here, my professor, my advisor at Columbia, and the people that I've been that really built my earlier path to global health at people at Columbia, and also the NDRI and New York University. And then on the second row, you see on the left here, Dr. Curtis and Dr. Gavin Bart, that I mentioned earlier, Dr. Dan Pfister from University of Miami, and here the Professor Rick Roshan and Wanterling from UCLA. And here you see a familiar face, Professor Jeff Klausner, and also one of the GloCal fellow who came to spend a year with us, Mr. Huân Dong, who's now finishing his fourth year of medical education. And here are also the team from UCLA. I have to mention in this picture some of the young Vietnamese fellows that through working with me and my colleagues, they now have got scholarship to study in the US. This is Dr. Sang Nguyen, who's now doing his PhD in epidemiology at Vanderbilt. Miss Lee finished her master degree training at Emory and now going to La Trobe in Australia for her PhD. And two of my students from college, Dr. Diep Nguyen and Dr. Lap Pham, they are now both at UCLA for their PhD training in epidemiology. So here the partnerships here are not just, I have to emphasize, it's not just at with international colleagues and mentors and advisors and so on, but really you have to build the local team. You have to build people that in your own country that you can trust and can work with, and then build their capacity as well. So one of my materials that I share with you was on the cascade of HIV care. And the reason why I share with you is that really the concept of the cascade of care is not just in the field of HIV. It was first, as far as I know, discussed in HIV in 2009, but now have been adopted in other fields such as the closest to my is addiction. That was recently discussed in 2018 that have been promoted to use in the addiction field. And if you look at all of the medical issues, medical problems of global health, cascade of care is a very important concept that can help you to identify what the author calls breakpoints along the care continuum. And then you have to ask yourself where my expertise and where the team, expertise of my team can contribute in addressing some of the gaps, some of the breakpoints along this cascade of care. If you look at the cascade of care in Vietnam, as you can see that we have a fairly high percentage that have been diagnosed with HIV among the people who estimated number of people living with HIV. But really where the drop off is the enrollment in care, right? And also the where you could another drop off is the people from once they are in care, whether they receive viral load or not. So for us, for our team, as I described earlier, at our center, we focusing a lot on the first two. This one, the drop off from in terms of people who coming for testing and knowing their status, especially among MSN. We also focus a lot on linkage to care and maintaining in care. This is the second 90, the second big gap in Vietnam. And here you see that that's where the substance users, people who with substance use disorders usually have problem with. So when we build a team, when we think about how a team can contribute to the cascade of care in Vietnam, that's where our expertise can contribute. So in summary, I would like to congratulate all of you for having the support from the GloCal program. I've read your profiles, and there are so many strengths, so many excellent experience and potential. And I'm sure that you will become champions in your own way in global health in the future. And I would love to meet with some of you in person in the near future. But there are some suggestions that I want to share with you, and I hope that they have been revealed from my talk. The first one is that you really have to understand whatever health work issue that you are working on. You really have to understand your own country, your own cascade of care, and in your own health issues. But understanding the local or the country cascade of care have to be contextualized in the global context. So we have to understand where Vietnam, where other countries is, how my country cascade of care for a particular health issue is compared to other countries, and what are some of the common, what are some of the differences that we have to be able to address. And really knowing where you and your team can contribute to fill in some of the gaps is very important. The second lesson that I also learned is being prepared for opportunities, even the smallest one. I think that some of the earlier grants that I were able to receive came pretty much from a small opportunities. For example, Dr. Todd Curtis initially came to Vietnam with just for Fulbright as a Fulbright scholar, but then as we worked together, we discussed about NIH funding and so on. So that's another example of how you build on opportunities. You have to learn how to take one step back, and in order to move 2 steps forwards. I think this is a very important lesson, not just in global health, but in almost everything that you do in life. And lastly, I would say that you have to build a dedicated team. You need people that support you, but also people who want to work for you, at least for a while. So not only the people who mentor you, but you also ready to be mentor people who want to work with you, who want to understand your goal, people who share with you the ambition to the inner work. So those are some of my suggestions, and now I'm happy to take questions or suggestions. Thank you.
All right, outstanding. Thank you very much, Dr. Yang. So let's open it up, Hal. I can't see. I'm not on the internet, so if you could try to navigate the questions, that'd be great, pal.
Yeah, sounds good. So please ask, either unmute and ask your questions or post them in the chat and I can read them out loud.
Hello? This is Emmanuel.
Yes. Hello, Emmanuel.
Yes, we've heard a lot about partnerships over the last 1 year. But I wonder if there's like a blueprint for making great partnerships.
That's a very good question. I'm not sure whether there's a blueprint. At least I've never learned or read a blueprint for myself. But I think that from my own experience, one very important quality to build partnership is the probably two issues. One is the openness, and the other one is the honesty. I think that you have to be you want to be people to trust you in order to think about building long-term partnership. And the other one is you have to be open to suggestion, open to things that you have never thought of before. So that's my would be my two suggestion for starting a partnership. I'm not sure if that's something you ask, or you want to look for other issues.
No, I think I just wanted somewhere to start from, because a lot of partnerships are, like, I'm from a low and middle income country, so it's always a big question of where do you start from? Do you just, like, if I know, like, in my head I know, like, if I had, like, an opportunity, so do you just send them an email and say, hi, your work is brilliant and I'm a fan? I don't know. I think that's where I was coming from.
Yes, I think that's one way to start a conversation with people you want to work with, and of course you have to look at their work very carefully, and then really to understand their work before you start the conversation that in that direction. So that for sure that's one way. Another I see here that you work with at the Makerere University, right?
Yes.
Yes, and I think that's a very well connected university as far as I know. There are a substantial number of international researchers that working with your universities, and I'm sure that that's one of the way. That's how you could build your connection and so on. And I think that through your GloCal participation in your GloCal program, your mentors both in the US UC system and also at the Makerere University I'm sure that would be happy to help you to connect with other researchers.
Okay, thank you.
Thanks for this talk. This is Phil Gurindo in Kenya. I was wondering, did you ever get to a point where you felt like maybe you're going to take a change in your career path? And if so, do you have any imaginations about what you would be doing right now if you weren't doing what you're currently doing?
Can you? I only got the second part. Can you repeat again?
Yeah, sure. Did you earlier on in your career, did you ever face a fork in the road, or or reach a point, a formative moment when you thought about changing trajectories? And if so, do you have any any guesses about what you might be doing today if you weren't doing what you're currently doing?
Yeah, that's a very, very important question. As I hear, as I show in my past in global health, had I not worked with my with Professor Clark on the first NIH grant, I would have been probably a assistant professor, or maybe an associate professor in anthropology, medical anthropology, somewhere in the US or in other country. The paths that have been usually been taken by my classmate in my program, that's the most of their paths, is to become an academic focusing exclusively on anthropological research and teaching in a program that's focusing usually an anthropology program, or maybe some school public health somewhere. But because of that NIH grant, and I have since then I've never regretted that I agreed with Professor Clark to supported him to prepare that grant application. So now here I am today.
Thank you.
We have a question from Archana. The question is, what were the favorable factors that helped you in setting up your own center? Also, what obstacles did you face in setting up and sustaining the center in terms of funds and research projects?
Thank you for your question. I think that the favorable factors in building the center is there are several favorable factors. One is that they're not probably our center is the only one in Vietnam that focusing on combining both the research, the education, and also services for the community, for the patient. So that's always have been the direction that we have chosen from the beginning, that we have to combine the three. And because of that uniqueness, and also another uniqueness is the focus on two key populations that are very important for Vietnam epidemic. I have to tell you that when we started the center, MSM at that time was not it was not a big contributor to the HIV epidemic in Vietnam when we started the clinic in early 2000, right? So, but we learn from, as I mentioned, that you have to always contextualize your cascade, your epidemic, in the global context. So we understood, we knew that would be coming. So we always chosen to focus on the two key populations. One is the people who use substance use disorders, and the other is MSM and transgender. So I think that another uniqueness of our center is is another favorable condition. And I think that another very important favorable condition is that probably is the country context. We have received in the past 2 decades have received a lot of funding and favorable funding from the US, from France, and other donors. So that's also a very important factor. What are the challenges in terms of maintaining funding? You always have to stay on top of the curve. On top of the curve, you have to be ahead of others. For example, right now we are looking. For example, we are looking into the PrEP issue for our MSM and transgender population. So you have to understand what are the issues in PrEP that are important for global audience, for the funding agency, for the researcher in other countries, so that when you propose a research topic on PrEP, you would be more likely to be funded. And I think that's not so easy if you live in a lower middle income countries like Vietnam, when you have a limited access to online journals and things like that. So I think that one of the way in which you could do that is some of the online some of the resources when you go to conference and other so that you can catch up with the literature and so on. And I think that's probably the major challenge is that you also have to stay on top of the issues that are interested to people outside of your own country.
Archana says, thank you a lot.
Thank you.
Okay, Pal, are there any more questions or comments?
None on the chat.
Okay, well, I want to thank you very much, everyone, for participating. It's a really exciting practical presentation, and we will let you know if we're going to have our June discussion. I still think that needs to be finalized, but for now, obviously, any further questions, you may email Dr. Yang directly, email myself, Jeff Klausner, email Pal, and good luck and have a great rest of the day.
Thank you very much. Have a good day. Thank you, and good luck with your program. Thank you. Bye-bye.